Good morning, everyone. On behalf of the organizing team, it's my pleasure to welcome Dr. Ali Abdul Karim Al-Obaidis. He is the chairman for UAE National Transplant Committee and is presently consultant nephrologist and transplant physician at Sheikh Khalifa Medical City and at the Imperial College London Diabetes Center. So welcome you and over to you.
Well, good morning, and thank you very much for this kind introduction. I really appreciate the organizers for this great event. This is the second year, and I'm really learning a lot about what's happening here and also around the world. So in the next few minutes, I'm going to shed some light, perhaps very relevant to the last point by Professor Corey about the maybe role of the national organ donation and transplantation committees and structures of putting a program together. I'm going to highlight our experience and also how did we go through this journey. I have no disclosures for this. We always see these slides and we hear about that globally we are only meeting 10% of the global demand because there are lots of people, 90% of people who need solid organ transplantation are losing their life. However, is this accurate? Maybe the gap is even more than that. And I think we have to strive to think, what does it take for us to actually be providing more than 10% of the global demand? And is there a room for regional collaboration according to the WHO guiding principles? Now, these slides I got from our dear colleague Stratus from the WHO just a few days ago during 𝐸𝐳 in Italy. So as you can see, 62% of the organ transplant operations are performed in highly income countries, leaving only 28% in middle income and 1% in low income countries. So really something should be done about it, especially that when we know that this is cost effective and it's going to not only be the right thing to do, but it's also going to save resources if we could align. Now, look at this slide where it shows the total number of transplantations from the year 2000, less than 50,000. Now we reach close to 160,000, but still, I think the gap is there because I think the growth in the end-stage organ failure and renal failure is higher than the growth of the population. Now, again, this slide is also quite informative from the WHO, where you can see the number of transplant centers when it's liver, heart, and lung in our part of the region per million compared to other the West or Europe. You see that for less number of people, they have more heart transplants and more lung and liver. So the task is even greater on the few centers that are existing in this part of the world. Now, I think the unique aspect of donation and transplantation is that in this specific field of medicine, we have two sides of the story. We have the transplantation science, and then we have the organ donation science. And unless we deal with organ donation as a science, as a particular aspect of medicine that requires its own infrastructure, its own scientific methodology, it's very easy for the system to label this as a social problem and justify doing very little about, when in fact, if transplantation is a science, organ donation is also a science. It requires scientifically mobilizing the community and doing the right things, but more importantly, setting the right principles as well as the right investments. United Arab Emirates, our country, is a small country with nearly 10 million population. However, we have a mixed diversity of the population, with 88% of the population being expatriates from 200 nationalities. So it's really a great, rich culture where we learn from different cultures, and we see that how can we have this program be rolled out. UAE is a federation of 7 emirates, and then we have these 7 emirates like Abu Dhabi, Dubai. They have their own local governments and local resources. When it comes to the donation and transplantation, we have a federal committee and a center, part of the Ministry of Health. And then we also have equal structures at the 7 Emirates or state, where we have licensed over the years a number of kidney transplant programs, and so far we have one multi-organ transplantation program that does all the other transplantation. Now, this is the milestone or the journey. So we started to have living donation kidney transplantation since 1985. However, it was only 2016 when we had our federal law permitting deceased or cadaveric donation, and our journey started from 2017. And with that, we started our multi-organ transplant. So we put a strategy together that we have to really analyze the current situation. We have to be data-driven. We have to have the right infrastructure in place, and also make sure that we align all the resources. And this is maybe a depiction of how the federal and the local states work hand in hand together. In general, like any other country, almost every hospital needs to be considered a donation hospital, but only few hospitals need to be given the designation of a transplantation center. So these are the results in short. So you can see that in 2017, we started to have 3 cadaveric deceased donation, providing 11 organs or saving the lives of people, 11 organs to save lives. And then you see that when we started to get a larger budget in 2021, we had 39 deceased donors providing 147 organs for transplantation. Last year, 55 deceased donors providing more than 200. And this year, we already exceeded. We anticipate we will double the score of last year. And this is gradually taking us to have a good deceased donation per million population, although our journey is short. Now, the numbers you see in circle are very important, and that is how many organs are we getting from every deceased. And to achieve a good score here, it's important that you have a good donor management program, as well as you need to be willing to share organs with neighboring countries. Because when families consent to donate, then they are not saying, you know, I need to donate in my state or my local region. They want to save life in general, and that has been something that we really wanted to do. So these are the breakdowns. Of course, as you can see, the majority are kidney transplant, but also we started our own heart, lung, liver, kidney, pancreas transplantation as well. So this is the donation per million population. We started with less than 1. We anticipate this year we will go to hopefully 10 or 11 per million population. The journey is still, of course, long. And this is what I refer to as how many organs do we get from every individual deceased. Yes, our numbers are small, but I think it's a good goal to be having good donor management, as well as willing to share organs with neighboring countries. And that is what we did. We, any non-utilized organ from the UAE, we offer it to neighboring Saudi Arabia. We also, more than 40 times now, we retrieved organs from Kuwait because they don't utilize lungs and livers, and we give them organ payback as 100%. We place their patients on our waiting list, and that's, you know, how we studied the European model of organ sharing. It has to be equal to equal between countries. We also, on one occasion, shared a liver and a kidney with Pakistan. Hopefully, they can also start their deceased donation. Now, when we analyzed the individuals and nationalities who either donated or received, they belong to 52 nationalities, and we believe that transplantation should be accessible without respect to color, gender, nationality, or income, and that's something we try to hold ourselves accountable to. But again, putting the whole system together, the ecosystem, requires lots of complex things to come together, from the urban procurement organizations, the transplantation programs, the labs, and above all, logistics. And I, again, go back to this slide that a few days ago the WHO were highlighting during 𝐬ZT, is that in addition to establishing something within the same country, we also have to think about regional network, because it is not realistic that every country will invest into a heart and lung and very complex procedures. So if this is good for Europe still to do, why not also this part of the world? Why not the Middle East? That we rely on these sophisticated transplant programs to become regional hub. This is another aspect of yesterday. There was a talk about paired kidney donation exchange. Again, when you are hosting the nationalities from many countries, you could also need to work with their home countries. Perhaps their donors are not in the same country. So paired exchange also is another perspective. Now I'm coming towards the end. So we, in addition to the scientific aspect, we also try to highlight the human aspect. So last year as well as this year, we participated in a conference in Italy where the art and the storytelling of donation was highlighted. You see the young man unfortunately died with the 17-year-old and was saved 5 lives. His parents were proud, and his story was an emotional in winning an award in Italy. The painting below was from a 17-year-old who received a liver. Again, this was highlighted. And the group photo in the middle is Reginald Green, the father of a young boy who was killed many years ago. Still, he wanted to save lives. So I think we need to also engage the public in an emotional and tell them what is it that they could be achieving if they consider donation. We try to integrate organ donation into a variety of sports activities like the marathons that we are having in few weeks. We also have plans for a conference that I would like to invite all of you to consider coming. So there is a conference happening in Dubai, 27th to 30th of January 2023. We hope to cover a variety of areas. And towards the end, I would like to highlight that we analyze the situation back home in the United Arab Emirates, and we believe the building block for us to be able to implement deceased donation is to give the responsibility to individual hospitals and recognize their good performance. So we are initiating initiatives or awards and recognitions to every hospital that is considered a donation hospital. And we want to make sure that they get the right resources, but also if donation is a right for the public, the majority are the hospitals who are in direct contact with these families, and we have to make sure that we are empowering them, and we want to recognize best practices not only from the UAE, but these awards are for local, regional, and international best practices, hopefully to be presented during the Dubai conference, in addition to best practices when it comes to involving even beyond the medical sector, going to universities, schools, and corporations, and NGOs, and others. So with that, I thank you very much, and looking forward to welcoming you in the UAE.
Any questions?
Thank you for a wonderful talk, sir, and enlightening us on your organ donation program at UAE. I just wanted to know, even though COVID was there is a significant improvement in your cadaver organ donation from 17 to 23, right? Almost 17, the number has become almost 200. So what measures other than the awareness which made the cadaver program to be better at your country?
Yeah, I think the awareness goes to the public as well as to the professionals. And the professionals are really, we train them in the UAE. We sponsor them to go to Europe, to go to North America. They obtain masters in organ donation. So I think the awareness, the first focus, I think it needs to be to when it comes to deceased donation, intensive care units, in the ICUs, and then the hospital managements and leadership. That is going to be the biggest. I mean, if the law of the land or the law of the country doesn't prevent deceased donation, then the focus needs to be on the healthcare professionals who are in direct contact with the relevant population, because the whole population is not relevant, and we know that it's a small percentage of people who die are able to donate. So our first priority was to align the healthcare professionals witnessing the end of life, to harmonize end of life with donation requests. And then the second is, how do we celebrate successful stories for the public and engage the public as well? But it's a tricky aspect, because if we start awareness too early with the public, they need to see successful stories before they can also be engaged.
Thank you, Dr. Ali, for a wonderful talk. My name is Aditya. I'm from Boston. Just similar question to what was asked. So what would be the barriers to organ donation, deceased organ donation? Like, I was looking at some surveys in India which talk about cultural barriers and sometimes religious barriers. So I was just curious, what would that be in UAE?
Yeah, I think we start to analyze, because we have 200 nationalities. I think we try to learn from different nationalities, have different perspectives. But I think the largest barrier would be if the family is not prepared in a gradual fashion from the admission that the prognosis is poor, and if they are not supported to come to terms with end of life. And that requires lots of support and resources, and also to eliminate any unintended consequence of miscommunication. So if the team is not coordinated, somebody says your loved one is dead, but somebody else said there is a small hope. So I think the largest issue is, how do we handle end of life? How do we support the families? And then I think there are different backgrounds and different cultures. Obviously, we have in general 30% approval or consent for donation, but this ranges. Certain nationalities consent for donation is 56 to 60%, other nationalities are 40, and other even lower than that. So I think it requires that we analyze it nationality by nationality, but the biggest factor is, are we preparing the family for an end-of-life discussion? And also, are we thinking what could be on their mind? Oftentimes, they want actually a second opinion. So we leverage hospitals not to take it personal, that we want to welcome an intensive care unit doctor from one unit, go to the other, and provide a second opinion to give the families peace of mind that unfortunately this is a new reality.
Thank you.